Good day, everybody. My name is Connie Morin. I'm your health manager for the nation, and I'm here to provide some very important information as well as a notice to membership regarding the situation that is currently happening here in our nation. We find ourselves in extraordinary times. People are experiencing a heightened sense of fear and uncertainty, but also hope and resilience as we see our nation coming together in unprecedented ways. Our hearts go out to those directly affected by this global pandemic, and our deepest gratitude for those tireless professionals working on the front lines to try and keep everyone healthy and safe. To them, I say thank you. Thank you also to the everyday heroes who are reaching out to the vulnerable people in their families and within the community with offers of much needed support. As a nation, we know we are in this together and that we need to join in collective action for the common good. We know that we need to take this seriously and that the more we do now, the greater chances we'll have of avoiding the most devastating impacts. As an act of love for each other, let's all follow close directions from the emergency management team, the Kehewin Cree Nation leadership, and the departmental managers to help flatten the curve, help slow things down, and potentially save lives. At Kehewin Health Services, we are doing what we can to be responsible, contribute to the solution, and protect our employees and their families. Self-distancing is critical, but we can and we must take care of one another, be kind, and get creative to support each other. With so many unknowns, it's hard to imagine what's on the other side of this crisis. What will life be like afterwards? Maybe we'll feel a greater sense of community, which is my hope. Maybe we'll know our neighbors a little better and have a more resilient nation. Maybe we'll see the value of slowing down and finding peace in nature, and even if that just means listening to the birds outside the window. On the other side of this crisis, there is a whole world to imagine, and in that world, maybe we'll have some confidence that when we take collective actions toward the common good, we're all better for it. Together, let's imagine the world after this crisis, one where we can recognize our interdependence and act in solidarity. One where we work for an evolution, from dominance to partnership, from fragmentation to connection, from insecurity to interdependence. For practicality purposes, and during this time of crisis, Kehewin Health Services is only offering essential services. And what that means is we are only operating a core staff of our professional nurses as well as the CHRs. And our offices are closed to the public, but we do have some information and numbers to share with you during this time. For emergencies, call 911. If you feel you have symptoms of the coronavirus, call 811. For Kehewin Medical Transportation, call Jody 780-573-9344. For Edmonton Referral, call 780-495-2708 or toll-free 1-800-514-7106. For any updates, information, or you have any symptoms of the coronavirus, please call the Kehewin toll-free number. It is 1-833-KEHEWIN. Again, 1-833-534-3946. Internally at Kehewin Health Services, we are initiating continued services, and especially during this time of a heightened sense of fear and anxiety, we do have Deb Jackson, who is our psychologist, who will be providing telepsychiatry services. Beginning March 23rd, 2020, she will open the phone lines and she will be operating this telehealth psychiatry to the nation for those who will require. In regards to home care as well as professional nursing services, our home care LPNs will be going out on urgent as need basis to those clients who need to be seen urgently. Any other visits are suspended for the time being until further notice and as developments occur. Information packages going out to the community will be delivered tomorrow with the community care packages that will be going out. But I will allow the social development, who is responsible for this initiative, to speak more on that. Rodney John is delegated as the elder liaison for the emergency management team. He will be assisting the LPN in the elders list to ensure that the information is circulated to them, and will provide translation services for those elders who require that. At this time, I would just like to say thank you for your patience. This is a new evolving crisis, and we are responding to the situation as best as we can with the team that we have and with the resources that are available to us currently. And I appreciate that. Thank you for your patience.
Good afternoon. Today is March 18th, 2020. Dear Kehewin membership and clients, we at Kehewin Social Development are working diligently to provide continuous services we offer to our clients and community. It is with great compassion and empathy that we will continue to deliver services for our nation. As this pandemic is global, we will have to rely on our traditional ways, ceremonies, and medicines. Commencing tomorrow, collectively working with Kehewin Health Services and the Education Department, delivery of care packages will start, and these care packages are now in place of the monthly food bank. These packages will include food items from our 4 food groups of the Canadian Food Guide, and also included in these packages will be baby products if required, feminine products, and cleaning and sanitation products. The first drop-off will be tomorrow, and we will be utilizing cardboard boxes and plastic bags in this first initial drop-off. Our next drop-off will be weekly thereafter, and as much as possible, we will provide plastic containers to deliver groceries and sanitation products, and ask that the plastic bin is sanitized and put on the stairs of the home after the delivery, so we may pick up and continue to utilize again for each weekly delivery thereafter. Schedules will be set up for the care package drop-off and weekly container pickup. As per our check release, checks will be deposited for clients that have active bank accounts on the 1st of each month. For clients who do not have an active bank account, call-in or email will be required for the client check drop-off to each client residence, which will also be at the 1st of every month. Clients can call 780-826-7853 or email kehewinsocialdevelopment@gmail.com to confirm where their check should be delivered to. Client signatures will not be required until a later date, and all clients will be put on 2 months continuing for now. Utility bills can be submitted through email to kehewinsocialdevelopment@gmail.com, and utility bills will continue to be paid, and also the signature required later. Please note that prior approval by client will be required in order to properly get your check to you. Tax returns will continue to be submitted by way of computer submission by Kathleen Dion. Please contact Kathleen at Kehewin Social Development at 780-826-7853 to ensure your taxes are completed. Our social development programs, GED, NIA Groups 1 and 2, and the KW program are currently suspended until further notice. Funding for participants will not change, and weekly updates will be provided as per each program. Our prevention program clients, in-office visits have been suspended until further notice, and our prevention worker, Tracy Belly Mountain, will continue to offer services through telephone, text at 780-815-0569 during regular office hours and after hours only emergency basis. Our office is currently closed to the public and will remain closed to the public. And as of Monday, March 23rd, 3 staff members will be on site daily to continue providing our essential services. In closing, we will continue to provide essential services for our clients and community. We will ensure that our community will be cared for during this difficult time, and this is the time for family reconnection, family love, and overall community kindness. Thank you from Kehewin Social Development staff. Any questions or concerns, you can call the Kehewin Helpline at 1-833-KEHEWIN or 1-833-534-3946. Thank you.